Okay, hello everybody, and welcome to our public health series called Careers in Public Health. This is a series that we're going to be doing several sessions of. This is our first session, so session number 1, where we're going to be hearing from 3 different public health professionals today. I'd like to welcome all of our public health seniors, all of our Masters of Public Health students, other people from across the university, whether you are an undergraduate student who's interested in checking out what careers in public health are, or a graduate student, or if you're faculty or other people across campus, you are all welcome to find out the many different careers that you can engage in public health. So we've asked our speakers to come today and just tell us a little bit about their path, and some advice that they have for people interested in careers like their own. So our first speaker, I'd love to go ahead and introduce our first speaker. This is Bridget Patrick. She has a Bachelor of Science in Public Health. She is a recent graduate of the program, and I'll let her tell a little bit about that path. She is currently a project manager at Southern Illinois Healthcare Foundation. She does interesting work with maternal and child health, and has some great advice for you all. So I'm going to go ahead and turn the floor over to Bridget Patrick.
Hi, everybody. I see some people I recognize from classes before. So, hey, guys. It's great to be here. Thank you, Dr. Klein, for having me. I'm wrapping up my workday, so I get off at 5, and I'm glad that you guys had me come today to speak. I guess I'll just get started and talk a little bit about my experience with the public health program, how it helped me go into my career and be prepared. As you all know, public health is a big topic now, especially with COVID. And I kind of had someone come into my class a couple of years ago and talk about the public health program. It was actually my advisor, Dawn. And she explained to me the benefits of public health program, applied health, how important it was to our landscape now, what we're living in. And I just really took to it. And I changed my major to public health, got involved in lots of activities. We have the public health ambassadors. There's Eta Sigma Gamma that you guys can look into if you want to do an honorary. There's always volunteer hours that you can do. I know that some of the public health students are on different boards and clubs at school, and you can promote public health that way. I was also the vice president of the Students for Reproductive Rights, so I did a lot of tie-ins for public health and reproductive practices throughout campus. I did win a couple of awards because I worked really hard, like I hope all of you are doing. I wrote a program for part of this class is you guys are going to write programming if they haven't already started that. But the last thing that I did major was write my programming, and I wrote it for a comprehensive health center, which is kind of like what I'm working in now. So my public health things that I did in school tie directly into what I'm doing as my career. Right now, I'm a program manager. I work at Southern Illinois Healthcare Foundation. It's known as SIF. We have about 30 centers. I'm in the corporate office right now. I'm going to transfer probably to our Windsor Center or our Centerville Health Center soon. I've been here about 3.5 months. I got here right out of graduation. I actually walked with my class in May, but I interned in the summer, which some of you might end up doing. I did intern after I walked across the stage, and then I got my diploma in August. I officially graduated in August after my internship was completed. I interned at IPHA, which is in Springfield. I did community health programs there, and I helped over the summer write a 3-year, $3 million grant for community health workers in the state of Illinois, which our company now is actually employing and implementing that process here as we're building our community health workers. So it's nice to kind of see something that you've created and helped participate in from the ground up, from baby to toddler to adult. So I thought that was really interesting to see my work that I did through my internship. It actually applies to what I'm doing now. So keep that in mind when you're interning. You never know what you're going to do and how that might apply to your career later on. Right now, I do a lot of API. So if you know what that is, that's your assessment, your planning, your implementation, and your evaluation phases. And yes, I really do have to apply it every day to work because I am a program manager. So part of my job is to create new and interesting ideas around the project initiatives that we want to do. Right now, I work in the maternal child division, and I also work in the FEMUR, which is the Fetal Infant Mortality Review Program. So not only am I helping mothers and babies thrive, but in the case that something happens and the baby does not thrive, I also have to interview the mother if there's a fetal or infant death, which is hard because sometimes we get accustomed and close to our participants in the Healthy Start program. So I kind of have a dual role where I run both programming, and part of my job is to really dig deep and think about something from the perspective of the participant. So I'm no longer a person that sits behind a desk. I have to think like a person, how I would want to be treated and talked to when I interview these mothers, because they're going through a very difficult time in their life. So I also am a mother. I have 4 children and I'm a grandmother. So I have to think how I would want someone to approach me on a subject. And a lot of that I learned in class with networking and a lot of our discussions that we did. You'll probably, I don't know if you're going to read the book that we read our senior year, where we talked about the Hmong people. Are you guys doing that this year? Okay, so I know it's like, why this book? But once you get into it and you see what it's about, you'll understand how it ties into public health because of the respect for other cultural beliefs. And that's very important in my job because I work with predominantly African-American community and I am a white woman. So for me, having another perspective is very challenging. However, it's rewarding because I can begin to understand the differences between cultures. And part of that book helped me relate to what I'm doing now. So it actually did pay off. It did make sense. It did help. And just knowing that I had other people in my group when we did that book that came from different backgrounds, ages, genders, orientations, it was important to apply that to real life now. So going back to kind of what I do on a daily basis, I'm in a lot of meetings because I have a lot of planning to do. I am a consortium leader, which means I have 4 quarterly meetings a year, and I'm in the process of planning our first one in February. I'm working with a guest speaker. Her name is Nancy Marawama, and she is the executive director of SIDS of Illinois. So it's sudden infant death syndrome, but she also does SIUE, which is sudden unidentified or unexplained infant death. So sometimes if you'll hear those 2 words, they're different, but they sound the same. So I'm working with her to do a presentation on our first meeting. I have to basically make sure everything's in place from the programming part to the communication part to the day of. And then after that, I have to get all our meeting minutes together. I have to email our partners and follow up with any information that we share amongst the collaboration. And I also do several events during the year. Right now, I just planned a Molina closet through Molina Healthcare. I helped order and set up all the stock, and we're getting ready to have a ribbon cutting ceremony at the beginning of February for a community closet for people to come to that need personal care products. They need diapers, wipes for their babies, anything that they would need, we provide free of charge. And that's our partnership through Molina Healthcare. So that was nice to be able to plan something and help the community at the same time. One of the big questions that I had when I came in here was, how am I going to run 2 programs? And that seems like a lot, and it is, but having public health background and having the instructors that I had, they taught me to be resilient. They were tough on me when I needed it, but they also gave me that encouragement that I could do it. So that is a big part of my success, is the public health program. And I'm not getting paid to say that. It's true. And I see Dr. Ma here too. They were a big part of me being successful, because there were times when I wanted to give up because I'm 42 and I, had a family and obligations outside of school. And that's really hard. And I'm sure some of you may have children or family members that you help take care of. You have jobs. You're thinking, how am I going to balance it all? And it's not easy, but you can do it. I know that you can do it. And so you just have to stick in there. You have to really find what you're passionate about. I wanted to be with mothers and children, and it took me a little while to get there. I had a job. I'll be honest, I had a job right outside of graduation. I was there a month. And most people are like, don't quit, it looks bad. But I had to find the right niche for me. If I didn't have that job experience right out of school and find that it wasn't what I wanted and how I wanted to be with my career, I wouldn't be where I'm at now. So sometimes, you know, you have to make decisions that are the best for you, and just go with what you know, and go with what you're passionate about, because that's where you're going to be the most successful. I mean, I'm doing really well here. I just got past my 90-day probationary mark. I'm able to provide for my children. I have great benefits here. I get along with everyone here. It's a great working environment, very family centered. I have great boss. I'm doing really well. And, you know, like I said, it's been an adjustment, because being older, I'm not young like I was 20 years ago, right out of college, but I still am right out of college. So I still have a lot to learn. But I do a lot of stuff with the programming, and it's very rewarding to be able to help other people, talk to other people, other cultures, other backgrounds, and just really get your heels in the community and make a change for the better. And that's what I've always been all about. So for me, it's really come full circle. And, you know, I'm always open to, if anybody has ideas or comments about, you know, their path or what they would like to do. I'm mentoring a couple students now who are in some of their the instructor classes. You know, I'm always here to help. They kind of called me the mother of the of the public health classes, because I was the oldest, but you know, I really cared about a lot of the students, you know, and I wanted them to do well. So if you ever need anything, I know my contact information is up. And you know, I don't know what else to say other than if anybody has any questions or wants to know more about what I do or anything like that, I'm open. Oh, Kenise has her hand up.
Hello, can you hear me?
Yes, hi Kenise.
Hi.
Hey.
So I just kind of got an interesting question, because this is the thing that I kind of fear the most when I graduate. Like, how do you know, and I call it your big girl job, that you were ready to get your big girl job, like taking everything that you learned and you were ready to get into the field?
Well, oh, go ahead.
Do you like, were you still hesitant? Like, I just don't know when I think I'll be ready to take on a job in my field, if that makes sense.
I think for everybody it's different, because here's the thing, I come from a different time frame. I'm, like I said, I'm older, I'm a non-traditional student. So for me, there's no better time than now, because I waited 20 years to get my diploma. So I knew at that point, if I didn't do something, it would have been all in vain, all that hard work. And so for me, I knew it was do or die. Now, you all, some of you, you know, maybe younger, some of you maybe non-traditional and more my age. I think it's a matter of personal discretion. I think if you'll know when you're ready. Let's put it that way. You'll know. I know you're capable, Kenise. I know what you're capable of. So I think you just have to make sure that you have your ducks in a row, you know, that you have the tools that you need, and just be confident. Always advocate for yourself too. That's really important, especially my women that are in this group. Always advocate for yourself, because you're just as capable as anyone else of doing the job. Know your worth going in, and don't let them undersell you. That's a big issue that I have found interviewing in positions. And I knew what I was capable of, and I asked for it and I got it. I think Melissa. Hi, Melissa. She has a question.
Yeah, hi, everybody. If I can just piggyback onto that, Kenise, I'm a career counselor in the Career Development Center. I would love to work with you on your confidence. So much of that comes from identifying the strengths and the skills that you've learned in your program, and then applying it to sometimes volunteer and sometimes earlier internship opportunities. So please come and see us. The other career counselor here is Carrie. We would both love to work with you And I think as you start to apply what you're learning in the classroom from your professors to these experiences, your confidence is going to improve and you're going to know you're ready. But let us help you get there.
Thank you. I appreciate that. I'll definitely work with you on that. Or try
Great,
to.
great. All right, thank you.
Does anybody else have any questions? It looks like, is there something in the chat maybe? Oh, no. Okay.
Yeah, feel free to put it in the chat. We
Yeah,
definitely,
sure.
typically, this group has a lot of questions, so. Looks like you've got one from Brianna.
Okay. Hi, Brianna.
Hello. I think I missed where like your current office is located.
So I'm in the corporate office, which is in Sauget. If anybody knows where the Grizzly ballpark is, I'm right next to the Grizzly ballpark. So there's a big building with a green awning up on top and it says SIH up. I'm right there. I'm right off of the highway. That's where I'm at now, but I'm probably going to end up being in our Centerville site or our Windsor, East St. Louis site.
Okay, I didn't know like if I guess why I asked is if you like struggled while you were looking through job postings, if you struggled to find like jobs locally, or like was there good options that are like somewhat local, or were you seeing a lot that you would have had to like relocate for?
I kind of a little bit of both. I mean, it just depends. A lot of stuff was virtual and now some of it's more back in person. I did notice that there's more opportunities now. They're either giving you like a couple float days or they'll do like a hybrid. But I saw many opportunities in Missouri. It all kind of depends on what you want to do and how far you want to go. I know for me, I just kept applying until I started getting hits. I will say having my LinkedIn up to date. I know Dr. Klein has us do our LinkedIn. If you haven't done that already, that was a big factor in it. I know my LinkedIn information Dr. Klein has. You know, you're welcome to look at mine as an example, or if you ever want to message me or talk or ask about anything, you guys are always free to email me, hit me up on LinkedIn. But having that and having a strong resume is very important. You know, having it formatted the right way, it's professional, everything down to the font, everything has to look good and you have to be confident going in. So, you know, you got to psych yourself up, have that pep talk. And I actually, you know, I had a lot of interviews, but you also don't want to sell yourself short, like I said. So know what you're worth going in, know what you're, like Melissa said, know your strengths. You know, you have to know what you're good at and how you would be an asset to their organization. I think a lot of us just psych ourselves out and think that these might be too much. We can, you know, bite off more than we can chew. But a lot of the jobs put fancy stuff in their titles and in their, you know, a lot of jargon in their ads. And sometimes it's not even as difficult as that. You just have to go in and have an interview and see what they're actually expecting of you. So don't be frustrated when you see crazy things in their wants and, you know, desires, because a lot of times if you have experience in something, they may overlook a little bit of education, or they may, you know, if you have experience, it might be in lieu of something else. So don't let that deter you. Just keep applying until you find the right fit.
Thank you.
You're welcome. It looks like Natalie has a question in the chat. How many jobs did you end up applying for before you got your first job after graduation? I would say it was probably 15. However, I had 8 interviews out of the 15 and I got offered 6 of the jobs, but I turned them all but one down just for various reasons. And a lot of them wanted to pay very low compared to all the amount of work I was going to be doing, like a lot of work. So you have to know going in, you know, what all that entails. You also need to think about your insurance, your commute, how far you're going to be driving, what that's going to mean for your gas. You know, in the middle of summer, I was interning at IPHA, driving there 2 days a week for free, because I was interning for free. So it was very expensive to do that, but you have to do that as part of your, you know, you have to think about those things when you're accepting a position or declining one. But I did have a lot of interviews and a lot of offers, But you, like I said, don't be afraid to say no either. If it's, don't jump at the first thing you get, or you might end up, kicking yourself later if it's not a fit for you. So take your time, but know your worth, like I said. I'm not sure if Haley had her hand up first, or there's a couple of, now there's quite lots of questions.
So you did have, I think there maybe was one before Natalie's. It was, do you have any advice for those who want to find more active jobs like yours? I also don't like sitting at a desk for hours.
Yes. So I have to make myself get up. I often do like yoga on my breaks because I am at a desk a lot. However, I do a lot of community speaking and relations. So I would try to kind of mix it up. If I have to shut my door and do stretches and get around and walk to the water cooler, do what I need to do. I walk the parking lot sometimes when it's nice, just to get out and have some exercise. I think it helps your mental and your emotional state. And it also, prevents you from having sedentary lifestyle, which is a big problem when you work in an office full time. So if you want a job where you're more active, program managing might not be the way you want to go, but I do find the time, and I also go to a gym outside of working hours. So I do maintain my schedule as much as I possibly can. But I mean, it's all about what your personal preferences, your lifestyle, and what you're willing to kind of bend as far as your physical and mental and emotional. I think, did Haley have, there's a bunch of questions in the chat. Let me grab Haley real quick and then I'll address these in the chat. Haley, you had a question?
Yeah, so we kind of mentioned this last week in class, and we were kind of talking about maybe like the pay scale, like realistically when you're out in the field and what to expect.
Mm-hmm.
So I was curious if you had any input on like maybe some of the offers that you had or anything. If you would not like to share, that's fine, but just like getting out with your bachelor's. And then also, sorry, 2 questions in one. Thinking about like masters, I think some of us may be like back and forth on if we should go further with our masters. So if you have any input on that, that would be great as well.
Sure. So I'll be completely transparent with you guys. This is me being real. The lowest paying offer that I got was about $39,500, and that was entry level. However, what I'm making now is $68,000. But I vouched for myself, and I'm also running 2 programs. So there's a difference between having, having multiple supervisors. I actually am a program manager, which means I'm at the level I only answer to one person. And then I have people that are underneath, beneath, I would say beneath, but, I manage other people. So I am not someone that works by myself. I have to answer to someone. And then I have people that I work alongside. So I have a lot of responsibility. So that makes a big difference. If I didn't have all that, it probably would be quite a bit less. I would say that a lot of the jobs were in Missouri that were higher paying. I think that there's a difference between what Missouri will pay and a lot of them are with like Mercy, bigger hospitals and CBOs and that kind of stuff. So it just depends on where you go. I mean, don't let the money though lead you where you're going to go. Do something that you're capable of doing and that you want to do, because there's always room to get a raise. There's always room to move up. And if you don't like it, get the experience, maybe a couple years in, 3 or 4, and then find something you're passionate, that you want to do. I wouldn't let just the money grab suck you in, because sometimes it won't be what you want to do. And then you'll feel like you're not fulfilled no matter what. It won't matter about the money. You see what I'm saying? So do what your heart feels is the right thing to do, because at the end of the day, the money comes and goes. But it has changed my life and my children's life. I will tell you that, coming right out of school and making that kind of money and having benefits for the first time in my adult life where I didn't have to depend on someone else. It's really been great. So it has opened a lot of doors. And then your other question, I forgot what you said. I'm sorry.
It was like some of us may be going back and forth on if we feel like we should get our masters or not.
Yeah, there's a funny story to that. So Dr. Ma and Dr. Klein both know that I applied for the master's program. I actually applied for the cohort of the MPH and MBA at the same time. And I got accepted to both, and I was so excited. And then this job opportunity came, and I had to kind of make that decision, just kind of like you're questioning now. And it was not easy. I mean, some days I'm like, oh, and then some days I'm like, I did the right thing. So it's all about what your priorities are. Again, I have children and I have to worry about my kids. My kids will always come first. Education will always be there. I know I have a place at SIUE if I ever have to come back. I know that they'll welcome me. I know I can reapply. I know, that I would do well in the master's. I didn't want to limit myself to one or the other, but I had to. So I'm the type of person I would have broke off and done both if I could. I would have done it. And I actually have 2 side hustles, even though I'm working full time. Dr. Klein, I haven't slowed down. I'm still tutoring to students on the side, and I also cater. So I work 8:30 to 5, and from 5 to 8 o'clock every night, I go and tutor my students. I'm also self-employed. So I work really hard, but it's paying off. It's really allowed me financial freedom and confidence in myself that I never had before. So don't be afraid to make the decision. You'll know what's the best decision for you. If you have to put it off, put it off. But don't kick yourself, because at that time, that is what you needed to do. So don't kick yourself. Make the decision, stick to your guns. And if you need to come back, come back. Just do what you got to do. Okay.
Thank
I
you.
think-
Thank you for
You're
sharing.
welcome. I got to hurry though. I think you guys are going to kick me out here in a few minutes, and I got some more questions. My job is located near East St. Louis. I'm right outside of there, actually. I'm in Sauget, which is kind of like a couple towns over. I'm kind of by in between East St. Louis, Centerville area. I'm right off of Moosehead Lane by Grizzly Ballpark. Let's see. What specific job titles did you look for while searching? Community health work. I looked for program management. I looked for public health.
You guys write these down. These are going to be good. So write these down while she's talking.
So community health working, public health. I looked up program management. I just started typing in anything epidemiology because not an epidemiologist, but maybe someone that can do the data, because I love data analysis as well. That is part of my job, is doing data analysis. So, anything that you're learning right now is pretty much out there when you start searching for a job. You just really have to stay on top of it, because there's going to be other people competing against you for that position. So you have to stay on top of it, stay focused, check with them often. Don't be afraid to contact them, because they have so many people and have so many things going on. They may not get back to you right away, but that doesn't mean that they're not interested in you. So don't give up and be discouraged. And if somebody says no, you know what? It might be a godsend. Don't let one person's no get you down to where you don't apply other places, because it's their loss. You hear that? It's their loss. If they won't hire you for who you are and what you bring to the table, somebody else will, and it'll be their loss. So don't let it discourage you. Trust me on that. How did you build my resume? Well, Dr. Klein, she kicked my butt, and every week when I would turn it in, oh, you need more detail, or oh, you need to fix your LinkedIn. Listen to her, because I'm telling you, it made the difference between me, going in there with a, humdrum resume. And yeah, I had a lot of great things happen to me, but I didn't have it presented the way it needed to stick out. That's the difference. You can have all the things on your resume that are really great, but if you don't have them like listed a certain way or showcased a certain way, or, your fonts off or any of those things, it matters to people that are looking at your resume. Trust me, you don't want it too long either. So you have to find a way to condense it a little, but a resume is important. Listening to your instructors when they're trying to give you pointers, that's important, because they know what they're talking about. It made a big difference for me. How did I build it? And did I do a lot of volunteering? I did do a lot of volunteering, a lot of public speaking, a lot of public health stuff. I was in a lot of organizations, and just mainly in the last 2 years. So I was always involved with organizations on campus, but not so much the public health until I got into the public health program. And a matter of fact, on March the 1st, I will be at SIUE with our recruiter, Kendall Hopkins, and we're going to be looking for community health workers and case managers. So I will be there helping, even though it's kind of not my wheel over here. They know that I know the school and I know people there, and I'm involved with public health. I'll always be involved with public health. And I'm going to come and try to recruit. So if anybody's interested, on March 1st, they're having a big career fair. I'm sure Melissa knows about it, and I'll be there. So if you have any questions or want to fill out an application for SIF, we are hiring, and they pay well, they have benefits. It's a good working environment. So if anybody's interested, please let us know.
Bridget, real quick, I just put the link to your LinkedIn there. Do you remember, do you have your resume up on LinkedIn?
I do have it on there, I'm pretty sure, yeah.
Okay.
If not, I could email it to you if you want to just put it on the class page or distribute it. It's fine. It's fine.
I'm imagining they would love to see it.
Yeah, I think it's on there, but if it's not, I can send it to you.
Okay.
It got to the point I was sending it out so many days a week. A lot of them will look at your LinkedIn once they give you an offer, or as they're looking at your resume. They won't not necessarily look at your LinkedIn right away. Sometimes people at my job, I've met a lot of connections just by them finding me on LinkedIn, people that I work with at SIP that I didn't even know about. So we have connected through even, you know, within the building. How many times did you have to rewrite or reword your resume? A lot. However, I will tell you, if you make it kind of more general, put the things that you're good at, that you're passionate about, but leave it open to multiple things. Like if you say you can do some data entry, don't say that it's for like a specific thing, just say data entry. Or if you're really interested in maternal child health, you know, put that, but you don't have to list like every single thing that you're interested in. It's a very broad spectrum of things in maternal child health. It could be mortality and morbidity. It could be epidemiology of maternal child health. It could be, you know, community health workers, like helping with WIC and you know, food stamps and things like that. So I would just keep it as broad as possible. That way you don't have to constantly go in and plug everything in. But it does help if you're switching gears or you're looking at something completely different than what you looked at previously for employment, to maybe change up the wording a little bit, but build a good base on your resume so that you don't have to do that a lot. And then I think I got a couple more, and then I probably got to go because you guys got someone else coming. Yes, I did have to drive to Springfield twice a week, especially during the grant writing. It was 8 weeks, and I worked 40 hours a week, my internship, unpaid. So it was tough. I'm not going to say it wasn't, but I hung in there. I got it. I knew I had to have it to graduate. I took it seriously. I did a good job on take it seriously, do a good job on your report when you're done, because it does matter. And always network. When you are interning, network. You have to get out there and talk to people. Put on that smile on your face and shine and be yourself. Be outgoing, get out there, make those connections, because it's interesting. I'll tell you real quick, really fast. So my internship, I was doing this, right? And I get over here, and my boss that I have now was sitting in on all the calls when I was interning on that grant, and I did not know it. I'm serious. And that's how she found me. So he did not know. We finally started talking. We're like, well, you helped write that grant, right? And I was like, well, yeah. She goes, well, I was sitting on those calls all this summer with IPHA. We were trying to build our community health worker program, because I think I remembered you. I said, oh yeah, what's your name? And I went through, and sure enough, all the calls that we had all summer during my internship, she was on, and without even knowing it. And she remembered me, but we didn't put the connection together until I got hired. So you never know who's watching. And that way, you know, do your best, network yourself, and you never know how those connections will play out in the future. Was it hard to find jobs that didn't require years of experience? Not really, because I'll be honest, a lot of times when you have that bachelor, that's a pretty good start. It's not, you know, yes, you have a bachelor's degree. Some of you think, oh, I have a bachelor. You be proud of that, because that's a big deal to employers. It shows that you put in 4 years of commitment and time, and you graduated and you did something worthwhile. So they see that as a tool and as something that's a bonus for them. Sometimes, like I said, they'll give you wiggle room if you have, you know, high school diploma and 3 years of experience, or whatever the case may be. I didn't have a whole lot of experience, but I came with life experience and a bachelor's degree. And that's why they hired me, because I've been around, I've had lots of experience in the community. I did a lot of things in school. So I had that experience behind me before I even came. Now, in maternal child health, not as much experience. However, as long as you can have room to grow and you have a base, a lot of times they will work with you, and they will look and see what your strengths are and apply that to what, you know, the position that you're going to be filling. So don't feel discouraged if you see it and it's 3 to 4 years experience. You know, if they have to have it, maybe bypass it, but always apply. You never know what they'd be willing to negotiate with you on. So don't let that discourage you. How many internships? I only applied to one. I applied to IPHA and I got it. But I had to go the long way because there was so many interns under a certain person. I had to go to community programs in order to get my internship. So if I hadn't gotten under community programs and the two bosses that I had, I wouldn't have been able to intern there. So my advice is get on it early as you possibly can. Start looking for your internships because they fill up quick, especially the paid ones. But even the unpaid ones, everybody has to have it as a requirement. Please get on that early. Otherwise you might be stalled and not get in on time. And I did mine in the summer. So don't be afraid to intern in the summer and work hard in the summer. Thank you, Brianna, for the props. Yes, the career fair is March 1st, and there's my LinkedIn and internships. So I am working with my boss and the recruiter to possibly offer internships in the future. That is something we do not currently do. However, it might be coming down the pipeline. And as soon as that happens, I will let Dr. Klein know and Dr. Ma know, or whoever would like to know about it. Even Melissa, I can touch base with you or something. Anybody that's interested, even, you know, down the road, or if you know somebody that's in college that may need an internship, once that happens, you know, we will be for sure letting people know. I'm sure it'll be all over the place. So that is something that we are trying to implement in the process of that. And I mean, that's all Denise, did you have another message or question?
I know some of us are doing the mental health first aid training on the 1st and the 2nd.
Mm-hmm.
So if we're still interested in the career fair, is that something we can talk to you about like separately?
I can contact our recruiter, or I'm sure Melissa probably knows who do you know who Kendall Hopkins is here at SIF? Have you heard of Kendall? So I'm sure Melissa probably has her information, but I can give it to you as well. But I'm sure there's time for, you know, if you can't make it, we understand. So, I mean, there'll be flyers, there's stuff on our webpage. I know Dr. Klein had posted it in the public health page. So you guys, if you haven't taken advantage of that, look at the job line, look at the public health, the career development center is great. They helped me with my resume building and the mock interview. I actually got a job offer from the mock interview, interesting enough, with Chestnut. Miss Karen had interviewed me and offered me a position for, I think it was a drug, and they were doing opiate outreach. Remember that, Dr. Klein? I got a job offer that day. And so sometimes you never know. I mean, I had to end up turning it down because I wasn't quite ready yet. I wasn't out of school and I had other things I had to take care of, but you never know what's going to happen. So always keep your eyes peeled, your ears open, and share amongst each other. Be a network and support each other. Because, you know, what one person might turn down in this group, another person might be looking for. So, you know, always be supportive of one another as a class. And I think that's all. Does anybody else have any other questions? Are you good? Okay, I don't see any other questions. Was that helpful? I hope I helped somewhat. Yes, no?
I think
It's a
that was
lot.
probably super helpful for them. And just really, let's just say a big thanks to Bridget Patrick for coming in and sharing all of this wisdom with us. Thank you so much.
You're
I think they
welcome.
learned a ton, and you know, she's there for you. If you can't tell, she hasn't said it enough times, which she has. She's there for you. So do feel free to reach out to her. Okay, so next thing is we're going to take a quick break. Our next guest speaker is here, but she won't start speaking until 4:30. So I'm going to go ahead. I'm going to pause the recording. Okay, we're back and recording again. We have our next guest speaker in our Careers in Public Health series. This is Kelly Rohan. Kelly is a graduate of our program, and I'm not sure, you'll have to tell what year.
I always am. I think it was December of 2013 or 2014. I at this point don't know.
That sounds about right.
Yes.
And
yes.
Kelly is a disease intervention specialist working specifically with HIV and STIs with the Missouri Department of Health. She also we asked her to come in and speak a little bit because we had people interested in epidemiology. So she's going to speak to that as well, sort of what she does in that field and sort of what that field does at the Missouri Department of Health. So I'm going to go ahead and turn it over to Kelly Rohan. Welcome.
Welcome. Thank you, guys. My name's Kelly. And what my job is, I know we kind of got a little introduction, is I do work for the Missouri Department of Health. I am in the Bureau of HIV, STIs, and hepatitis C. I don't really focus on hepatitis as much. Our communicable disease team really focuses on that. But just a basic rundown of like what my day consists of is, anytime a patient goes into a public health department, a hospital, any type of medical place, and they are STD tests are ran or HIV is ran, and those labs come back reactive as someone has a positive test, it is required that that doctor or health department reports it to the state. Most states have a long list of diseases that by law have to be reported to them. And so I'm specifically in that Bureau of HIV and STIs. So we really, really hone in on HIV and syphilis. Unfortunately, gonorrhea and chlamydia is there's just too much of it for us to really go in depth in following, with syphilis and HIV having more kind of crucial, potential long-term damage to the body. We want to make sure that those patients are really, really focused in on, and that we follow up with them on proper treatment. So again, each day I get a caseload, and with those cases, I reach out to providers wherever they were tested and make sure that the providers, that they tested them correctly, completed all the right tests, follow up to see why that patient was tested. Did they have any signs or symptoms of anything? Kind of why, how did we get here? And what is our next steps? Have they been notified? Do they have plans to notify them? Do they have a treatment plan set up? And then I am kind of almost on between local providers and the CDC. So I'm not a doctor, I'm not a nurse, but we do follow the CDC guidelines for, testing and treatment. So I will then speak with these providers about what the CDC guidelines would be as far as treating. Mainly that's with syphilis. HIV treatment, that's kind of another step, which I'll kind of get into that in a moment. But so I will follow up with these providers to make sure that we get this patient notified, that we get them set up with proper treatment, because depending on staging and things like that, when a patient might have been infected, can determine how much medication is needed. And then I do an interview process. So that interview process is where we will speak with a patient about their recent diagnosis, and mainly just discussing recent sex partners, because ultimately our goal is to stop the transmission. So we want to make sure that any of their partners, whether they knew they had an infection or they didn't know, that they are informed with confidentiality. We do not disclose any information about that original patient, but we want to let them know that they might have been exposed to an infection, and we help get them resources or into a local health department for free testing and treatment. And although I am with Missouri, I know that the Illinois health departments do this exact same thing. So this is something that these are types of jobs, a disease intervention specialist, that, if you decide to stay in Illinois after college, it is something you could look into in your own local health department, and state health department do have my position available. So yes, I follow up with those patients. I apologize. With those patients, and I make sure that they're treated adequately, that they are interviewed, and we're kind of a middle person for them, so that, again, their confidentiality is kept. If they don't want to tell this person that they might have gotten an infection, especially if they're with multiple partners, they don't know where they got it. That's where we can kind of step in to inform that person and hold confidentiality for someone. And then from there, we just make sure after they've been treated adequately that they follow up with their doctors to make sure that their infection is gone. And that is mainly around syphilis. So syphilis is a completely curable infection. It is one that does not always show signs or symptoms. So I know a lot of times with gonorrhea and chlamydia, people have very obvious symptoms. you'll go into the student health center or to a doctor. They will test you and treat you usually right then and there. Syphilis is a little bit different, and sometimes there is no visual symptoms. So that's why it's really, really important to always advocate for yourself to have that testing done. A lot of times we'll see providers only doing urine samples, which urine is going to be gonorrhea and chlamydia. Syphilis and HIV are done through blood. So I always encourage you, again, if you go into the health center to be screened or to your doctor, is make sure that they are doing both, urine, if they need to do any swabbing, and also blood draws as well. So, and that is kind of the biggest part of my day. With HIV, again, that second step is once someone is notified, we make sure that we get them set up with an infectious disease doctor. So there is a number, it's called linkage to care. It is kind of a middle ground between me and at the state level and the providers, and with a HIV doctor, to make sure that this person is set up with care quickly, that we get them in for more evaluations, more testing, to kind of see, how sick they could be at that time. And then also get them set up with a case manager in case they need additional resources, anything like that. So that linkage to care line is kind of, I don't want to say an emergency line, it's not, but it is definitely a number that really helps us get these patients into doctors much quicker than someone just calling a doctor to try and get a normal appointment. Sometimes it's like, can't see you for a month. We can't see, especially right now. So we kind of help those patients get into those doctors much quicker. Now I know there were several that are interested in epidemiology. So my position, I am not an epidemiologist right now, but I do have epidemiologists in my office, and that would be kind of my next steps as far as moving through and moving up. And I will say, so with the state health department, in my specific bureau, what an epidemiologist sees is they're really focusing more too on just the trends of what we're seeing with syphilis and symptoms. They're definitely talking more with like our laboratories and kind of just looking at the Missouri map in general and kind of making connections of like, okay, this specific area, we're seeing a lot of this and a lot of symptoms like this, like what could be going on here? What things that doctors or providers could be doing better as far as outreach. So they just have a much bigger role in that aspect of kind of catching on to the trends, but working with, our laboratories, with our providers, testers, everything like that, too. But as far as like, they still work cases like I do, they just have a little bit more of an in-depth role, if that makes sense. So that is basically what my job is. And I definitely, if anyone has any questions, I can kind of elaborate more on that or any interests. I will say, so I actually got this job back in 2016. I got it through you still have the Facebook group, like the alumni? Okay. Well, that's how I found this, I guess. So yes. So that group is great as far as job postings and internship postings. And I don't know if it was you, Dr. Klein, or Dr. Henry, someone posted about this position. And I honestly, when I applied for it, had no idea what it was. I was just applying for everything at that time. And it said like state public health. And then I didn't even realize it was STDs, HIV until I got to my interview. And so I was like, oh, okay. Which was kind of good because I was like, probably many of you where you're like, I have no idea what specific area I want to go into. We take so many classes in this program, which was amazing to have the background in it all. But sometimes it can make it a little bit difficult of like, what did I like the best? Where do I really want to hone in on? So I just try anything. You may be totally surprised by that. Like I did my internship in women's health, and then now I'm, doing the HIV and STI route. But I did find this job through a posting. My previous supervisor was I guess, what are they, like student teachers or it was Andrea Stratford. It was,
Yeah, she was,
or like
an
in their
instructor.
masters when they have to do so many hours or something. I forget what that's called, but she was my, like, I don't know why I want to call it student teaching, but it's not exactly what it is. I think she taught some of like the 101 classes for you guys.
Like, well, we usually just call them lecturers. So,
Okay.
I mean, she could have been like but she wasn't a grad assistant, but yeah.
Maybe, yeah, I don't know. She was doing a master's type of program and
Mhm.
somehow had a connection. So she was able to post that position. And they actually, when I got the job, hired 3 of us, and all 3 of us came from our program. So I will say that our program is very recognized even since then, when we have had people interview. I know that not all of them have taken them, but there's usually at least one. I know 1 or 2 other that have applied for a job within my field. So it's definitely something that is very recognized. They see at the state level, they know like, okay, SIUE's public health program definitely has great people coming from it. The other 2 that I did get this job with, one is actually back in Illinois, I think working for Madison County Health Department. She's an HIV supervisor. Jennifer, oh my, I can't forget her last name. And then Brittany Dively, she actually went off to the Peace Corps. Not Dively, it's Brittany.
Oh
I
my
can't
God.
remember her last name.
Dawson?
Yeah,
Brittany?
something like that. But she ended up going to the Peace Corps, and she's been over there ever since. So for
Dawkins,
years.
Brittany Dawkins. She's still
Dawkins,
there.
yes, that's
She's
it.
the one
Yes.
in Madagascar, you guys.
Yes.
Remember,
And she, yep.
they may remember me talking about that. We had somebody from the program who went to Madagascar.
Yeah,
Peace
it
Corps
was.
and never came
She
back.
never came back. She like pops back every once in a while, but she started with me, and then she kept just being like, my heart's telling me I need to go do this. And we're like, go do it. Like, well, this will still be here when you get back. And then she never came back. But I do follow her on social media, so I know she's enjoying what she's doing. But yeah, so it is nice to know that our program is seen very highly, you know, in the workforce. And I know that I have actually worked with several other people there at other you know, whether it's HIV clinics as case managers or doctors' offices, that have all also come from our program. So it is really cool to see, like, they didn't graduate with me, but I know that they were, you know, there kind of at the same time or right after, where we've always connected of like, you know, I was in that program too, or I graduated from that program. So it is really cool to see people come from that. But yeah, I know someone did have a question. I apologize if I can get back to that. Someone had the hand raised. Maybe forgot.
I did, but you kind of answered it. I kind of assumed that you said you graduate as soon as you got a job as soon as you graduate. So I assume you have a bachelor's, or
Yes,
did you?
so I have a bachelor's in science. I actually did not start my job right after I graduated. I graduated in 2014. I went and traveled for like 6.5 months. I went over to Australia and did nothing health related. It was my time to travel. And then when I came back, I will say at first, like when I first came back, I did struggle a little bit to find a job. Again, it was kind of me, I think, overthinking a little bit, thinking I needed to find specific, like where I wanted to, like what I wanted to do. Did I want to stay in health? In like women's health, which is what I did my internship in. Did I want to try and branch out? Different things like that. So I really just started applying to like everything. I was very lucky though too. My internship after I graduated, before I left to go to Australia, they hired me on. The position was already a part-time position, but they hired me on. And so, and knowing that I was going to be leaving. And then even when I came back from Australia, I was very upfront about like, I'm eventually going to be looking for something full-time, but they hired me back to work as well. So I know the last speaker was talking about internships and everything. And very much so is like, definitely get in on those and, you know, make good connections, because they really can help you further your career. And a lot of them know that they are temporary, and that you know, if they're not paying you or if they're just part-time, that, you know, eventually you will find full-time. But it does really, really help with that gap as far as finding something or even networking to find something. Yeah. So, but I did graduate with a bachelor's of science. Yeah. And I think so. It's now public health, and I feel like I was one of the last community health Yeah.
You were,
Yeah.
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 You were like in that transition year.
I was. I feel like my senior year was the like senior seminar class. There was like one, and then that next year our program just blew up, and you're like, I'm gonna have like 2 or 3 classes.
Mhm.
So
yeah, it got busy there.
yeah.
Other questions for Kelly? She has an interesting story, like I think that sometimes it can feel intimidating when we have guest speakers here, because it sounds like things are, her job sounds amazing, especially for those of you who are interested in sexual health. But understand, like it was a process to sort of get there, and
It was.
and I think that's what makes your story really interesting is what you were talking about earlier, which is you don't necessarily have to have everything figured out to sort of enter the professional field. Like that comes right as you get more experience.
Yeah. And I will say too, I know like probably the last time I had I spoke, I was actually leaving this job, and this was right before COVID. I loved this job and I loved it then. I had the opportunity to get into fitness full time. I apologize for my dog in the background, and do fitness full time. And so I jumped because again, I'm like, I know this job's still going to be here. Like if this doesn't work, I know these people, I've made great connections. I worked here for almost 4 years. So I went into the fitness realm, not knowing what was about to happen. And 2 weeks later, COVID hit. And I will say that I had a little bit of like guilt knowing that all my coworkers were pulled from STDs, HIV, and thrown straight into COVID, and making sure that they were doing whatever was needed. Again, a lot of our interviewing is kind of like, I guess, contact tracing in a sense. So they were training people to be contact tracers, reaching out to people, trying to follow up, doing a lot of that. So I tried to come back. I learned quickly fitness was not what I wanted to do full time, that this is very much like my thing. Sorry, that fitness was not my full time, and that this was something that I really wanted to do. And so it took a little bit to get back, only because of positioning and COVID, but I did eventually come back, and I started back in April, and I'm so glad that I did. So, oh, please stop. I apologize. So I had a question there. I saw a hand.
I was just wondering if you think that if you would have gotten your master's, would that have made a difference, or do you have your master's?
I do not have my master's. Honestly, I was one where I love school, but I didn't love school, if that made sense. I was just very, very eager to get out into the workforce. And a lot of not providers, a lot of businesses will actually help pay for master's programs. Again, I wasn't sure where I wanted to be, so I didn't want to go get a master's in a certain area and then that not be where I end up. Hold on 1 second. Let me make sure he's set up. He's not going to listen. I apologize. So yeah, but master's wise, I don't have a master's. I know you guys have a program now though, don't you? Is that in full swing?
Mm-hmm.
Okay. I know for a while it was like, we're getting there, more paperwork, but we're getting there.
Yes, it did take a while to get started, but no, we do have it now. Our deadline is actually March 1st. So we're still, for the fall. Yeah. So we do have a question in the chat, which is Jordan has a question. What were you going to do in fitness? So they want to hear about other. So
with fitness, I actually I was coaching fitness classes like part-time, even when I was with the state. I started doing that back in 2018. And then I got the opportunity to help open a fitness gym here in St. Charles area. So I did that. And so that was definitely difficult too in the middle of COVID when you're trying to open a business at the same time. So I did do that. I was not, the whole management side just was not me. I'm just such an active person. And so I just felt that it just wasn't for me. And at the time, and trying to help like start a business during a pandemic was just not, it did not work for me. I wanted to be out there helping people. That's, that's what I came to originally. That was my whole career plan. So yes, it would have been helping people in fitness, but I just long term was like, this is not where I want to be. So, but yeah.
One thing that I think the students are interested in, and you guys can tell me if I'm like hitting this right. We're always interested, like at the State Department, do you have any sense? I mean, you're sort of past this, but like in terms of entry level positions, do you have any idea of like salary ranges, or do they do paid internships, or, those questions? Remember what it was like when you were a student and you're like, I have no idea how much to expect for salary, and it's hard to work for free.
Yeah, so I will definitely say, so like when I first started with the state, gosh, I was making like in the 30s, like teacher, like low 30s, but I was like, okay, it's great. I have a job. I don't, wasn't really like, didn't care as much. My bills were getting paid, everything like that. But I will say we do not have internships in my specific bureau. But I do know that some of like the local health departments, I feel like within do, I'm not as aware of any in the state level, but I would definitely say the local health departments, which again, they all work together pretty closely, so they can connect. But as far as entry level pay, I mean, again, it just really depends. Some of them can get away with not paying. Some are going to be in that low, 30 range. I definitely, when I came back, that was kind of my biggest thing was, okay, like I need to get paid more if I'm going to be doing this. And luckily the state has increased our pay, and they slowly now, it's been going up for the last couple of years. So, we're definitely not nurses. We're not doctors. I would say anywhere from like 40 is pretty reasonable. At least for me now, seeing that I'm definitely I'm higher than that now, which is great. But I feel like entry level wise, that's probably the best. Yeah.
That's helpful. Thank you.
You're on mute.
Thank you. You have another question, which is Brianna wants to know, do you work remotely?
So I do today, and I do on Tuesdays and Fridays. So we have the opportunity to work more remote now. Previously, I did not. My office is downtown, but this job in general is we do a lot of field work. So I'm going to doctor's appointments. I'm going to people's houses. So I guess you could call that remote, but as far as like home remote, we do now. We used to pre-COVID, we weren't, just because of a lot of things were outdated then as far as but understandably so with like HIPAA and everything like that, they were just more cautious on that. So, but I do work remote 2 days a week from home, but I'm also too, what's nice about that is my team members, again, I think we have 7 of us in our office, and we all generally live in pretty separate areas throughout the eastern region, so of Missouri. So we go all the way up to like Warrenton, all the way down to Perryville almost, and then all the way to the Illinois border. So like I'm in St. Charles. I have a coworker who's down more south near Jefferson County. I have coworkers that are in Chesterfield, Creve Coeur, some that are in North County. So if we ever do get, like, if St. Charles County has a case or whatnot, they'll call me. I'm usually the closest. Even if I'm working from home, I can pop over to their health department and help and assist if need me for an interview or anything like that. So, yeah.
Very helpful. Other questions for Kelly? You've got a question in the chat. Alexis asks, would you say you're content with your job and don't plan on leaving?
I'm very content. I love this job, and I loved it before. Like I said, I only left to try something new. But I am very, very lucky. I have a great group of coworkers. great supervisor. I think, like I said, is before COVID, there was a lot of things that needed to change, and we had some higher ups that were just living in old ways. And I guess I didn't even realize it back then that they were doing some things that probably we shouldn't have been, or we should have been, adapting to. And I think it might have been a little bit of a power thing at the time. So now it's very nice because I work in a very non-stress free job. Again, they're so much more flexible with the remote work, as well as when it comes to going to patients' homes. So again, I work the whole eastern region of Missouri. So the majority of my caseload is in St. Louis City. We do have to make sure that those patients are notified, and sometimes they're homeless. Sometimes they don't have working phones. Sometimes, whatever the case may be. So there are times that I do have to go and try and find them based off of information we have. And that can lead us into some dangerous neighborhoods. But not even the city. I mean, when we go up to Lincoln County or even St. Charles County, some of these rural areas, I'm going into areas where there's no cell phone service and, trying to find this person. So that used to be a little bit more nerve-wracking. And now, our team is definitely more safety precaution of like, hey, your life is more important than someone else's at this point. Like, you can't do your job if you're not here, and they can't get help if you're not here. So, we definitely make sure that our safety comes first, and use all of our avenues as far as, sending letters to addresses and phone calls, everything we can before we actually have to go to a patient's home, because again, we don't know who they're living with. And we don't know who's going to be there. Sometimes these situations can be where someone might have been in a situation where they might have been raped, or there might be something going on where someone in their household, they don't need to be knowing about that. We have very young patients. I got a case today with a 16-year-old. And so I have to, I still, even though she's 16 years old on the state level, we still will not communicate with the parents. The doctors, theirs might be different, but always helps us to know if the parent is involved. Did they bring the patient in? Is the patient okay to talk about these types of things? But, I don't want to go to that 16-year-old's house knowing that their parents are there when their parents may not have even known they went to get tested. We don't always know everyone's backstory. So, yeah, I love my job. I love what I do. It's never a dull day. I mean, we hear the craziest things. Unfortunately, though, with sex comes drugs and comes all kinds of things. So people do some crazy things, and we find out later. And you do the best that you can to help them, but unfortunately, sometimes people don't want to be helped. So that is definitely a struggle in this job, is when you so badly want to help this person and educate them on how dangerous it could be to not get treated, or, even the legal side of someone with HIV. By law, they have to inform their sexual partners, and some of them won't even go get tested because they don't want to know if they have it, so that they don't have to tell their partners, which is just so scary and, very sad for those people that get infected and, didn't know. But yeah. So, but yes, I love my job. So that's why I say, I know Illinois does have my same position. Right before I came back, I actually had an old colleague reach out to me and send me the job posting for Illinois. And I know that their pay is a lot higher. I think it's too because they don't have as many of us, but I definitely say I saw their pay was definitely a lot higher. So definitely something to look into. And then I did see another one. Are you required to be vaccinated? So I don't know. I don't think they required it. Again, now I'm not sure if many business companies are requiring it anymore. I was vaccinated before I came into the job, so I wasn't really questioned about it. I would say no, to be honest with you. But I also haven't had any new colleagues come in since me, or I haven't asked anyone. But when I went through my process, I don't think it was asked. And I don't think that you're muted.
COVID vaccinations, right?
Yes.
Specifically.
Yeah. Sorry.
Okay.
That's what I was assuming.
I think that's probably what Jordan
Yeah.
meant.
I had the job that I had previously. It was not required. So I worked for Compass Health Network for a little bit doing some crisis intervention counseling too, kind of in that little gap between fitness and coming back. And they highly encouraged it. And I was working with a lot of people who did have high medical risks. And so for my personal comfort and theirs, I was vaccinated. But I was not asked when I came back, and I know that they didn't like follow up on like boosters or anything like that. I think it at that point was personal preference. And just knowing that you may be working with high risk, people and medical. We do all have our own offices in my specific bureau. I know not all of the state employees do in my office. But since we talk about such highly confidential information, and also too, our vocabulary is a little bit more different. My supervisor actually years ago, the reason we got offices was he was in a cubicle setting, and obviously he's using the word penis and vagina, and he kept getting HR called on him for like sexual harassment. Yeah. So they were like, okay, we have to put them in their own section because we can't keep getting, and someone's on the phone with someone talking about like with schools and education, and then they're hearing penis and vagina being said in the background. I think it was understandable, but at the same time, it was a little much. So we are all kind of separated. If we ever have any colleagues, again, that have any sort of like exposures or anything, we take precautions, and we can work from home too. So yeah. So let me see. Hi, Sydney. It is a very intriguing job.
It was a direct message to you.
Oh, I'm sorry.
No, you were completely fine. I just
will
put my name out there.
I'll reach out to you more about it. Anything specific that, with this job, or anything you had questions on that I could answer?
I don't have any very specific questions, but when I just didn't even know that there's a job like this.
In the photo department.
Yeah.
Didn't know that there's a job like this out there. I did my senior project on sexuality education.
Yeah.
And just like hearing you talk about just your job in general was just kind of eye-opening to me, and I'm just very, very interested. So I'm definitely going to do some research on it. Could you tell me what your specific position is again?
Yeah, so I'm with the Missouri Department of Health. I am I guess it's called a health program specialist, but I'm a disease intervention specialist. The health program is what is on, like job titles, but I am specifically a disease intervention specialist, and I'm in the Bureau of HIV and STDs for the state of Missouri.
Thank you.
Yeah,
Thank you so
definitely.
much.
It is very interesting. I even have doctors and nurses when we call, they're like, your job, I can't even imagine. Like, what is a day in the life? And so, yeah, it's definitely, it's very interesting. There's always something crazy, but at the end of the day, like, that you're helping people, and that's what's so rewarding. And each day, nothing is ever the same. So yeah. And you make great connections with doctors, health departments, everything like that. So it's really, really great for connecting. So yeah.
Yeah. For our last speaker, when Bridget was speaking, somebody asked about like active jobs. So this is Kelly's job is a great example. If you are somebody who likes to be pretty active, doesn't want to sit behind a desk. There's public health jobs for every person.
Oh yeah. I do sit at my desk some days, but there's some days where I am just like go. So, but yes, definitely a good happy medium there.
Well, I think we are actually out of time. So this has been really helpful to just sort of see another aspect. So let's give Kelly a round of applause and lots of thanks for sharing a very interesting job and her story of sort of her path.
Yeah.
So thank you so much,
Of course,
Kelly.
definitely.
I really
And
appreciate
again,
it.
too, I don't know if anyone heard me before, is the mental health first aid. I definitely encourage it if there is room for it. It is a great, I guess it's a certification. No, it's a certificate, I think.
And I think it used to be, it would qualify you for 3 years.
3 years, yes.
Yeah.
And I just requalified because I think I did mine in like 2019. So mine had just expired. So yes, I highly encourage anyone to do that. Definitely reach out if anyone has any questions. I'm happy to talk. I'm happy to, I don't want to take up the time too, but if anyone ever needs to do a Zoom call like separately, I'm happy to explain more or anything like that. Because I know that I loved these type of speaking when I was in this position, just to hear that there is jobs, there is things we can do and whatnot. So I'm happy to explain and let you guys all know. So best of luck, everyone.
Thank you, Kelly.
Thanks.
Really
Have a good
appreciate it. Bye-bye. Okay. Hello and welcome back. We have our third and final speaker of our day today of this session of careers in public health education, or public health, actually. And we are lucky enough today to kind of shift directions a little bit from our previous guest speakers. We have Gregory Pavelka. So Greg, I mean, I call you Greg, but I think that's, what I'm used to from when you were a student a while ago, and he is currently working as a safety and occupational health specialist, interestingly enough, with the U.S. Army Reserve Command. So Greg has been really helpful in the past, just speaking about like jobs with the federal government, really talking about his experience, both in that area of safety and occupational health, because it's something that we don't always think about in public health, but it's a really key and important part of public health. So I'm going to go ahead and turn the floor over to Gregory Pavelka. Welcome.
Thank you, Dr. Klein. Hello, everyone. As she said, my name's Greg. I'm not big on the whole formality thing, so Greg is more than fine. I did put my email in the chat. Feel free if you find this interesting or you need help navigating usajobs.gov. That is where everyone in the federal government applies. So it can be a little daunting, but it's actually pretty easy to navigate, surprising enough, for a government system. So feel free, send me a shout if you need any help or just have any questions about it. And then also, I will be telling you my full salary. You can look it up online, so it doesn't matter at all to me. All right, so I graduated with my BS in health education before it got changed and everything in 2016. I started working at the VA as a GS5. Now, and these are going to be a little older figures because, it was a little bit ago, but I was making about, I want to say about 35K or so a year. As a GS5, I was doing transportation I was like a dispatcher. So we did any veterans who did not have the means, whether they were like stuck or not stuck, but they were like in a wheelchair, didn't have transportation or didn't have enough money, we would get them to and from their medical appointments. I did that for a little bit over a year. Then I got another job, GS6, with also with the VA, but with the Veteran Canteen Service. I did travel pay, which is what I did when I was in the military. So that was pretty easy. But then on USA Jobs, there's a certain criteria where if you graduated within the last 2 years, they open up certain positions. And that's what I applied for it 1 year and 11 months after I graduated, but still counted. And I got a GS7 to 11 position. So like it's a training status. So you start at GS7, next year you're a 9, and then the next year you're an 11 pay grade. And that was with the safety and occupational health specialist with the Army Corps of Engineers in South Korea. So they paid for me to go on up, flew me, took my, they took my car, they packed up all my stuff, and I went right over to Korea, to Pyeongtaek. And so then I spent the next over 2.5 years in Korea doing that. And that was awesome. I mean, I saw like BTS. I saw them walking through the airport twice. That was I'm sure some people there really like K-pop. Just wandering around Korea was just awesome. While I was there, I did a lot of I did construction safety. So this was included hazmat. So you have your SDS, your safety data sheets. So like how hot can these chemicals be stored? What happens if they're in direct sunlight? What happens if it gets in your eyes? So then you go into the PPE area, personal protective equipment. Then there was, just fall protection safety. I did training, so now I'm considered a competent person in fall protection safety. So just looking at fall protection harnesses, seeing about guidelines, and just anything and everything that people can kill themselves while they are, or injuring themselves while they're working construction. Like I had to learn, I had to and then tell them what they're doing is wrong and then how to fix it. So it was definitely a very interesting and a very informative few years. And then in September of 21, I moved back here to St. Louis. I got a job with the Army Reserve Center. It's up on Goodfellow Avenue in St. Louis. So not the greatest spot, but oh well. And there I do I'm charged for basically the whole unit and the building. Excuse me. And so now I do all sorts of, so like we have a mechanic room in our facility. So like where they actually will break down Humvees and MRAPs and all like the big vehicles and everything. So you gotta, are they doing it safely? Do they have eye wash stations? Are they putting all the used batteries in the proper containers? Then it goes on to like, we just had all this ice, right? What happens if someone is going inside and then they slip? Is that then we go on to the more of the OSHA stuff. Is it a recordable incident? Is it reportable? What happens if they're injured, like actually like seriously injured, like a slipped disc or something like that from the fall? What happens then? Now for my unit, the reservists, but I don't know how well you guys know the military, but every 2 weeks once a year for 2 weeks, they go to, for us, we go to Fort Leonard Wood, and then they do firing ranges. Well, now I'm in charge of about 70 or so people's safety. They're, making sure they're being safe on the range. Are the weapons pointed down range properly? Did they clear the weapons properly? And then what about ammunition? Ammunition is a whole nother monster. You've got all the different things with proper storage, proper transportation. What happens if they don't use enough of them? I mean, there's so many different things. And then also we're doing this at Fort Leonard Wood in July or August, so it's really hot. Are the guys, are all the troops, are they, drinking water? When we were going over the thing, our plan for it, I was just like, oh, yeah, you guys got all this food, and you've got their cots ready to go. You've got their ammo. Did you guys already have water available for them? And they're like, oh no, we forgot about that. So, so sometimes it's just really good to have someone else in there who can just be like, hey, like, I'm not worried, like my job is not to worry about whether or not the mission gets done. My job is to make sure whether or not the people go home is the main thing. I want everyone to go home with all their fingers and toes. And even though sometimes they fight me on it. So, so the job is very, very broad. Just the other day, we actually, one of my, we had a sergeant, he was driving a vehicle with a trailer, and the wheel just popped off the trailer. Well, this is now a Class D accident according to the Army, and so now we have to investigate. We have to put it all up and contact all the correct people and everything else. So with the military and everything, it's just a lot of paperwork sometimes. So But yeah, it's definitely, it can be pretty interesting. Lots of classes. I mean, besides South Korea, I did 6 weeks of training at EKU, Eastern Kentucky University. I did 4 weeks of training at Fort Rucker, Alabama, which is only 2-hour drive from the panhandle of Florida. So that was some good weekends out there. I had a training conference in Las Vegas. It was awful. Don't recommend it. I was then there's just North Carolina. We have got places. I was supposed to do training in Maryland, Aberdeen, Maryland, but that got canceled, unfortunately, due to COVID. And that's a whole nother thing. And then also, not just so like I have applied for other positions. I had an interview for one, which was here in St. Louis, but it was for the FDA. And that position, what I'd be doing is I'd be going to all the different research facilities and doctors' offices and everything else around here, and basically making sure that if they are testing on animals, they're doing it ethically and morally and within the guidelines as per the law. So there's not just one particular facet of this job. There's the FDA, you have OSHA itself. If you kind of rearrange my job title is Safety and Occupational Health Specialist. They're just occupational safety and health administration, right? So they have dibs on the actual like that type of title. So I can't have that particular one, but we do pretty much the same stuff. I just don't fine people is basically it. There's no monetary fine for whatever I do. But I just be like, hey, this is wrong, needs to get fixed. And then if someone doesn't get fixed, then people, they just escalate up higher up the chain. And then eventually, shockingly, it will get fixed. So, I mean, does anyone have any particular questions? I can go further into detail on what I did in Korea. I can do further detail on what I do here, how I got started. Yeah, go ahead.
So what did you do in Korea? That's what I was interested in.
Yes. So in Korea, I did, it was safety and occupational health specialist with Army Corps of Engineers. And so my particular job was construction safety. So I'd go out to all of the different job sites and then just make sure they're doing it safely. Like they have these, so like they're building massive facilities, like 10-story tall barracks and stuff like that. So they'll have like these massive pile drivers where like it'll be 3 stories up and it's just pounding the ground, putting in these pillars. Well, it's really loud. So going around, you got to make sure hey, is everyone wearing their ear pro? And then you have all the general stuff, right? Like your steel-toed boots. Like they have all sorts of different criteria of what can be a steel-toed boot, what's a composite toe boot, does it cover the ankle, does it do this, does it do that, like making sure they got on their vest, making sure they have on their hard hat. I mean, it's just like it's a pretty broad area. But there's also with the Army Corps of Engineers, like if I got a job here for safety, I'd be working pretty heavily on all of the like the dams and the waterways for the Mississippi Valley. Yes.
Do you want to go first, Kenise? Mine kind of goes with this.
Okay, you can go ahead if it goes with this.
I was just gonna ask if what you do, since that was Korea and then you work for the US Army, does it like transfer, like do you guys have to do different things when it goes to different countries, or are you just primarily focusing on your guys?
So with being in Korea, they almost all of the contractors that are working on the construction sites are Korean. And I don't know about you, but I don't speak Korean. It was in one ear and out the other. So I tried to learn, it did not work. But yeah, so but part of the agreement for all the contractors, like the Korean construction contractors, to be there is that their site safety and health officer, their SSHO, has to be fluent in English. And I mean, in general, many Koreans are bilingual at least a little bit. They teach English in class and everything. So they're in elementary, middle, and high school. So, but still, like, you know, someone's doing something unsafe. I mean, a big old, you know, stop. And they would stop. Like, they understand that, you know, when I say stop, then they're supposed to stop whatever they're doing. And then I'll tell the SSHO what went wrong. We'll figure out a way to work around it, or sometimes simple as, hey, they actually need a respirator when they're drilling concrete. Or it could be, you know, hey, no, actually I'm stopping work. You cannot work on this anymore until you get all of this unscrewed. So, you know, it's it could definitely be difficult.
Thank you. I appreciate it.
Yeah. Ms. Hunt?
My question would be, how much education do you have to continue to do on your job? Because you say you have to, you know all these things, and it sounds like you're constantly having to learn, new things. So how often do you have to keep up with the education?
Oh, that's a very good question. So, I'm what's considered in the government as CP12 certified. So CP12 is career path 12, which is the safety thing. And so that included the 6 weeks at EKU, where I did a whole bunch of OSHA classes. And then also the 4 weeks at Fort Rucker, which were more like Army specific things. So like EKU would be like, like we did stuff on like welding safety, workshop safety, stuff like that, construction safety, fire safety. And then at EKU, we did more, at Fort Rucker, Alabama, we did more along the lines of what to do when you're, loading up a troop transport. How does that safety work? And then there's conferences that you can do. I'm still CHES certified and everything. I put it on my email. No one seems to know what it is, but it's just a couple extra letters after my name. So I mean, it's just there's definitely quite a bit, but all the stuff is a PDF, like all the guidelines and everything that I have to follow. There's tons and tons of manuals. No one ever is going to know all of it. But it's all like with their phones, it's just real easy. You just pull it up and then you can search for that particular item. Like with Army Corps of Engineers, their manual, it's a EM 385-1-1. It's a massive 600-ish pages. Like, you're not going to know all of it, but you'll know some of it. You can be like, hey, I'm pretty sure that's wrong. And they actually have an app. So you just go in there, type what it is, and then you'll be like, oh, here's the entire thing. Bam. This is actually what the guide is, and you're wrong.
Okay, thank you.
Mm-hmm. And I don't think I said, so right now I'm a GS11 step 2. So you have your main pay grades, GS1 through 15. And then once you are that particular pay grade, every year pretty much you'll get a little quality of life increase, if you will. So like GS11, I was a step 1, now I'm a step 2, and then I'm about to be a step 3. And so step 2, I believe, is about $73K a year, and then step 3, I'll be at 75. So I'll hit that nice mark right there.
Yeah, one thing that's important to note, and you can tell from what Greg is saying, is there, it's like a grid. So you'll know exactly what salaries are. So when he's talking about GS something, there is actually like a grid that would tell you this is the salary for this particular job. Yep. So it can be one of the many advantages to working for the federal government. And Greg, can you speak a little bit about, because I know like he is a great resource on how to find jobs through the federal government with the federal government, because it's not easy. Like, I know, Greg, you kind of know how to navigate it, and he can give you some ins and outs, but honestly, I think it is, people often sort of lose their way as they're actually applying. So sometimes I wonder how many people actually make it through with a complete application. Like, if you manage to make it through there, there's already a lot of people that have sort of dropped out of the process. Wouldn't you agree with that, Greg?
Yeah. Oops, sorry, dog. Yeah, so there's sometimes you can see how many people have actually applied for that particular position. I've seen it be as low as like 13, and I've seen it be as high as like 500 something. Depending, like, a lot of that is, location, where is that job located, and then if it's remote, and then anyone can get it. So, but I mean, like, there's so many different things. And then also, like, one big thing is that I'm sure when you're doing you're like typing up your resume and everything, you want it to be concise, brief, you want to get your point across real quick. With government jobs, that your resume is the exact opposite. You want it to be as long and detailed as possible. So, like, I mean, my resume, it's probably breaking past 4 pages right now. And just, you're doing something, oh, cool, just add that in. And then, like, I've hit the character limit on at least one of my Korean position. Just putting in, like, I put in there, CP 12 phase 1, I graduated, I did all my courses, and it was, at a 94%. CP 12 phase 2, I got this percentage. I mean, it's just, you're just doing you're putting every little thing that you do in there, because a computer looks at it first, and then someone will look at it. So you want to hit all the keywords as possible. I saw
Jaden,
someone had their hand up.
Yeah, I think, Jaden, did you have your hand up?
Hi. Yeah, I did. He kind of answered it a little bit, but I was just seeing, because this is kind of the stuff that I enjoy. I like environmental stuff a little bit, but I also just like regulations in general. Like policies. I like bossing people and telling people they're doing something wrong. But no. So, like, I just want to know, like, is there like an intern, like, are there internships like possible that can like lead into what you do? Because I've been seeing like job positions, but a lot of them are asking for like OSHA 30-hour certifications. And like, as a public health, like, bachelor's, like, undergrad, do you think that's possible to like obtain that certification? And do you think I should put that under my belt like as soon as possible, or should I wait until like I get the job to add that on my belt?
All right, so for that, it like, honestly, I mean, this is kind of one of those, it depends. It really depends on the job. If you find a job and it says, this is a 5 to an 11 or 7 to an 11 or something like that, then they will you'll see it in the job description or the responsibilities and everything, but like, they will more than likely, if it's that type of thing, they'll pay for it. You'll, like, I have my OSHA 30 card as well. So like, they'll pay, and I've taught the class, like they will teach you or pay for you to go to that class, and you don't have to take leave or anything like that. And they'll pay for it. But now if it's something that says it's required, well, also look at the wording. There's some that says like you have to have it before you apply, and then there's others that say you have to have it within the first 6 months. If it's within the first 6 months, they'll pay for it. So just you have to look at the wording of how it's put in there. And then as for like environmental, there's environmental sciences, there's the EPA. I mean, there's like you have to look for it. And then also, unfortunately, for safety positions like my own, there's not many here in St. Louis, but there are quite a few all around the US and also overseas. Like a big one is Germany. I saw a position in Spain. There's a safety position in Singapore. There are safety positions in Japan and Korea that pop up every now and again. But I mean, if you want to be in Florida, like basically around military bases, for at least for like my type of position. So Florida, there's ones in New York, there's ones in California, Arizona, South Dakota, I've seen, Montana. Just that's for my particular position. But if you're looking for just St. Louis, there's a good 200 plus positions available now for civilians, for people who aren't already in the federal service.
Yeah, it's interesting. It's such a different area that I think it's great to hear. I mean, you know how we talk about like public health is like this giant umbrella. I think having, people and talking about their professions really helps bring that home, doesn't it? Where you're like, wow, there is like stuff out there for, these different areas. And, Greg has been really generous, like with his time and his advice, because navigating applying for a government job can be challenging. It can be challenging. Like if you go, I did go ahead and put the USA jobs that .gov link that Greg was talking about earlier in there. And that is something that I would definitely recommend taking a look at. There are benefits to working for the federal government.
Yes.
Like Greg, do you want to speak a little bit
Yeah.
to sort of those benefits versus working for something private, for example?
Okay. So one big thing is that like if you are hired and you can most positions are going to have like a 1 year like tenure that you need to get, and then honestly like you're pretty much unfireable. If the government is not going to pay you, there's something much worse going on than if the check doesn't clear. Most government entities now have their pay good for an entire year if in case the government shuts down. So if we go a whole year without the government paying anybody, we're there. You don't need to worry about your job. There's something else seriously wrong. They have all the insurance, your vision, dental, your like the full medical insurance, all that stuff. Very generous rates as far as I can tell. And you don't have to do it. You can do your own or whatever. Then there's leave. So once you hit 3, so when you start out with 0 federal service hours, you get 4 hours of vacation every 2 weeks, and you get 4 hours of medical leave every 2 weeks. Once you hit 3 years, you go to 6 hours of vacation every 2 weeks, and it still says 4 hours. And then once you hit 15 years of federal service, you get 8 hours of vacation time every 2 weeks, and it still says the 4 hours of medical leave. And so, once you have 15 years, you get basically 12 hours of vacation every 2 weeks. So that adds up pretty quick. When you go overseas, so like every city will have their own locality pay. So you have a base rate of pay, and then you go into, they have a locality pay to just cost of living adjustment. Here in St. Louis, it's like 16% or something like that. If you go to California, it's going to be 25 or something like that. I don't know off the top of my head, but it's going to be much higher. If you go overseas, so like when I went to Korea, I did not get that locality adjustment, but instead they paid for my house, the apartment that I was living in. And so me as a single guy over in Korea, no kids or anything like that, they're like, all right, here's $30,000, find an apartment, and then you got to use it all. And I was like, oh wow, for the entire year that was the rent. And so I got a 3-bedroom place, heated wood floors, easy walk to base and to a local market and the nightlife and everything. I had heated wood floors, a full kitchen. There was a jacuzzi in the master bath. I mean, I was like, all right, well, this is awesome. So like if you go to Germany, you're going to get something similar, or any of the other places if you live overseas. So like it is very easy to save some money, especially if you go overseas, because your housing is completely paid for. So that was a very good part. And then plus, if you're overseas, you can see all the sites you've never seen before. And then, in Korea, I visited Thailand, I visited the Philippines, I went to Japan, and then COVID hit, and then I couldn't go anywhere anymore. So that was disappointing, but it was awesome. All the traveling, just sightseeing, and just, I could take my car and just drive an hour, and I'm someplace I have never seen before. Buddhist temples, gorgeous hikes, like the sea, the ocean. It was awesome.
That is really interesting. I think we're starting to run out of time, but you do have a question in the chat.
Oh.
Janavi asks, what are the chances of getting a job in government for an international student who's on an F1 visa? Ooh, great question.
That is a great question, and it's not one that I can answer definitively in any way, unfortunately. However, in the hiring process, there are questions that ask about your citizenship. So I've never clicked no because I never had to. So, but if you are here officially on a visa, I can't imagine why they would say no because of that, unless it was some sort of you needed like a secret clearance or a top secret clearance or something like that. So I would say still apply anyway. USA Jobs is really nice because you can load all your documents, everything you need, and then you just click, add, answer the questions, and then you're done. You don't have to, there is no upload your resume, now type your resume. There is none of that. Thank God. So worst thing they can do is just tell you no, and you're in the same spot. That would be my thing for it.
Mm-hmm. Absolutely. All right, Greg, this has been so helpful. Let's give him a round of applause and our thanks for such great information. He did put his email in the chat, so if you want to reach out to Greg at a future date, that is in there. All right, I'm going to go ahead and stop recording. So that ends the series. Students, stick around for just a second. And thank you so much for attending.
Thanks for having me.